everybody. As part of the Wellbeing and Healthcare series, today I am very glad to share with you my conference paper, which I participated with in the Amsterdam 5th Non-Professional Interpretation and Translation Conference, which was held last June 2021. So I'll be sharing with you the slides. This is the title of the conference, and this is their logo. The presentation agenda, starting from the conference paper title, ending by the questions and answers, and also sharing the contact address for the purpose of future collaboration. That's the title of the conference paper. Urgent need to train medical practitioners professionally to become certified professional medical interpreters and translators. This is a call for establishing a professional medical interpreter translator license. Before we start, it will be wise here to distinguish or to make the difference between two terms. Most of the people mixed up between them. So if we talk about interpretation and translation, we have translators and interpreters. Their work come like hand in hand, and sometimes the same individual is doing the dual work, which is being a translator and being an interpreter. For translators, they concentrate more on written text, and their job here to translate written text, like for example, books, contracts, websites, whatever. And for interpreters, they deal more with verbal and non-verbal communication by interpreting medical appointments, patient history, court, for example, proceedings, conferences, like live conferences. And of course, if we say non-verbal language or communication, we mean like facial expression, body language, eye contact. All of these will come together with the verbal language communication to ensure conveying the correct message. Also, this conference paper is based on my research finding, my doctorate thesis research findings. So building on that, we have the keywords here: language communication barrier, cultural challenges, coping strategies, qualitative research approach, exploratory study, phenomenological study, semi-structure interview, thematic analysis method, medical professional translation and interpretation versus non-professional interpreter. As an introduction to start with, recently medical and healthcare interpreting has become one of the fastest growing specialties within the field of interpreting. Of course, as a result, there is an increasing demand. So if there is like a need, for example, there is on the other side, there is like a demand. So there is an increasing demand for properly trained, qualified, and certified medical interpreters. And also there is a need for formal medical interpreter training programs, and this is what we will highlight within this conference paper. Also, as well as not only a professional training is needed, but as well as we need accredited formal training, like certified formal training programs to meet the professional demands of highly specialized area in medical and healthcare interpreting. And this is fall under the umbrella of public service interpreting. So we are taking like a case in this paper and concentrating on interpretation for special professional purposes. And we selected the medicine and healthcare as an example, since my work is in the I mean, like in a healthcare or medical institution. If we just have a look at the cartoon pictures in here, it represents the case problem or the research problem itself that we are talking about. So you can see here from this picture, like the healthcare provider or the doctor, and on the other side you have the parent or the next of kin, and here is the child, or it could be like her son or whatever. So you can see from here, from the facial expression of both parties, that they are lost because of the language barrier. The mother or the relative is trying to express and explain to the doctor her son's healthcare or health problem. And the doctor, of course, is trying to take the important notes and the patient history, but couldn't do that because of the language barrier. So both of them, they need the help. If we go to the next picture, it is in the operating theater. And of course, within the operating theater, we have the pre-operating stage or phase. We have during the operation, and we have the post-operating stage. So the patient, of course, here, the communication level, let's say here, is less than in any other places within the hospital, in the operating theater. But sometimes if the patient is conscious, like fully conscious, for example, after recovering from the operation in the post-operating stage, or could be like in the pre, for example, or during like semi-conscious, for example, and able to communicate verbally and or non-verbally even. Then, of course, here we have the communication between both parties. And you can see here that the patient is trying to perhaps like explaining some pain that she's suffering from or something that she needs, for example. And on the other side, you can see the healthcare providers. They have a question mark on their head, which means they are lost. They don't know or they don't understand the language or the spoken language of the patient. And there is no mediator. And it's very hard here to bring someone to interpret at this time. And even if they bring someone, they manage to do that, perhaps that person has not the, I mean, like the fully, he or she may not be fully qualified to act as professional medical interpreters. And sometimes, of course, these practitioners, they end up by losing patient, for example, life, or there may be some complication later on because of the delay in understanding each other. The same thing in here, more emphasis within this picture. You can see both the doctor and the patient. And you can see from here the bubbles, their, of course, inner reaction. How can I explain that if he does not have any medical knowledge? And the patient saying here on the other side, no, not there, which means this is not the place for the pain, for example, that he's suffering from right there or right here. How should I explain my feeling to the doctor? What can I do? I need help. And the same thing for the doctor, he needs help. So if we talk about the clinical context, like the context that we are in, we have the following parties within the process of doctor-patient communication or conversation. These parties or these individuals, they require the translation services and they are involved in this process. And they are as the following. We have medical practitioner, or we call them healthcare providers, like similar terms. I mean, these terms are commonly used. And we have patients, and there may be also with the patient, we may have patient relatives or next of kin. So for them to survive with the language communication barrier, if there is a language communication barrier, each party is speaking a different language that the other one or the other side person, for example, is not speaking it, then there will be like a communication barrier. So, of course, here, what do they need? What do they do instead as an alternative to help themselves? What coping strategies? Whom they will seek? Let's see here the examples. They will use volunteers, and from my study findings, I found out that 90% of non-Arabic speaking medical practitioners ask for the help of their medical or non-medical colleagues. This is highlighted because of the high risk with no medical background to assist them in doctor-patient communication. You can imagine if they are having no medical background. The ad hoc interpreters, and we need just like to simply or briefly define ad hoc interpreters. This is like a person who's not trained to become a professional interpreter. It could be a family member of the patient, of course, a bilingual or trilingual staff requested to interpret, for example, or to help, or it could be someone in the waiting room or in the waiting area waiting for his or her, for example, turn to meet the doctor, okay, and volunteer to act as interpreter, but they are all entitled as non-professional interpreters. As well as it could be a frequent, for example, family member who come with the patient. Sometimes, some doctors will ask the patient if they have language communication barrier, and if they have these patients who frequently visit the clinic for checkup or for treatment or follow-up or whatever. So they ask them, do you have, for example, like a family member or a close person to you who's, let's say here, refer to our Bahraini context and refer to English language as the mean of communication in most of the professional areas. Do you have someone who speaks like good English, for example? If yes, bring that person each time you come for a doctor visit, okay, to help us understand you and also to communicate with you, okay? So they ask for help from their patients. So due to the literature fact that hiring professional medical interpreters has a high cost, is very expensive, and most countries in their public hospitals, they do not hire interpreters. Why? Because of the high cost, and medical practitioners in this case rely on the available staff, both, as we said, medical or non-medical on duty. And this is the my thesis, as a reference to my thesis, doctoral thesis title. So that is the title as a reference, because I am trying here to base all of that on the findings that I have. So the impact of language communication barrier on non-Arab medical practitioners, healthcare delivery, and ways of addressing miscommunication issues. It was an exploratory phenomenological study of Bahrain run by the University of Liverpool. Relevant literature review, just like a brief reference to the literature in terms of these areas that we have just like highlighted together. So we have Bischoff et al. State that the main issue of discussion is about difficulty to hire interpreters because of high cost, as we stated. And the same authors here point out an important coping strategy, which I believe as a researcher could possibly solve the issue of the expensive cost of hiring professional medical interpreters to work in the medical setting as like permanent, or it could be like with a permanent contract, or it could be like with a part-time contract. Like in both cases, it costs a lot. So what is the solution? To solve this problem, the author thought of improving communication between xylophone patients and physicians by training, by professional training. Train and make use of the available human resources that you have. So instead of paying lots of money to hire these professional medical interpreters and pay that much cost of money if there is no budget for that, Of course, there is an alternative. The available human resources, like, for example, medical practitioners, medical students, let's say, we can here help them to cope with this barrier by training them professionally with these like accredited professional courses and training programs that we will refer to later on. Okay, and that can be part of the professional incentive given to the, let's say, medical practitioner. Can you, for example, can you act or have like a dual role within the hospital or the medical institution to become, for example, a healthcare provider or a doctor or a practitioner, plus being a professional medical interpreter? So if yes, then you have to go through this training program, take that accredited course, finish it successfully, be certified, and then you will get like here an amount of, for example, to help you, an amount of money that to be added to your salary. It will not be that much as like, for example, having like full salaries to be paid to these newly hired medical professional medical interpreters, of course. So these can be part of the solutions. So these medical practitioners are encouraged to be trained in dealing with allophones patients and working with interpreters. This is in the literature, of course. We have another also author, Almouqahwi, 2015, claims that learning a few words of Arabic by non-Arab speaking nurses is not enough to communicate. Of course, here, if learning medical terminology, let's say in Arabic, for these non-Arabic speaking medical practitioners, it will not be enough to enable them to communicate with confidence with the patients and patients' relatives. Because if you don't here and put things like into context, it will not be easy to them. So of course, when designing these, for example, programs or training programs, things like this should be taken into account, putting things into real practice. And we'll talk about that, we'll refer to it as well. Here also referring to something important, when we design any training courses, we should here, for example, for our context, we should also integrate the language with the cultural aspects of it. For example, like in our, let's say, Arab context, yeah, medical context. So we have these, for example, patients, like Arab patients, male and female. So they prefer, if there is like an interpreter, they prefer the male interpreter for males and female interpreter for female, and this should be taken into account because the patient later on will feel more comfortable to express themselves and also to of course here to accept whatever instruction coming from their doctors, okay, or advice. So that will make them more cooperative with their doctors and trust them more. So cultural aspects should not be neglected at all when teaching or training these people with language communication. So I thought by participating in this conference that it would be a good opportunity to me to present the research problem case, as well as to present the initiative projects or research done after the thesis, of course, stage to resolve the problem, and also from this stage to have the opportunity to call for across international institutions collaborative research and projects. That's an important quote. Poor health literacy may lead to poor health outcome, thereby creating financial stress on individuals, families, as well as communities. How did I decide that there is a need? So improving health literacy begins with assessing people's current level of health literacy. How? Conducting need assessment, got the needs from I illustrated that need, and I understand it, and I understood it from the doctorate research findings through my research participants, and they were non-Arabic speaking medical practitioners in different medical specialties, and in different hospitals, some in a private and some in public hospitals, and some have like previous experiences working in other diverse Arab countries like GCC countries. So the outcome was very helpful, the findings. And also, I learned that from their language communication barrier challenges that they face, their scenarios from daily, real-based clinical practice, doctor-patient communication, as well as tailoring health interventions based on that. These coping strategies and solutions, part of them were illustrated or recommended by the practitioners or the research participant, and part of them from the illustrated also or adapted from the literature, and the other part from the researcher herself, coming up with solutions through the experience, based on my experience also with dealing with these like medical students, and also training some medical practitioners and teaching languages and translation. Developing program evaluation criteria. Of course, for any program, it is essential here for the success of any training program. There should be different stages of evaluation should take place for improvement, future improvement. The noble aim out of all of this effort to promote health in my context and also worldwide. So here we have also not only locally, but also we aim for internationalization, internationally. As the idea of this conference paper is also applicable to different parts of the world, facing a language barrier in a diverse clinical context. So the reasons behind having no professional medical interpreters or translators formally hired in our hospitals. Hiring a professional interpreter, as we said, is expected to add unaffordable costs. Another reason is the lack of specialized interpreters in the field of medicine and healthcare. Why? Because when we studied like translation and interpretation, these translators and interpreters, they studied or they have like a rotation to work in different translation fields. Like, for example, in literary translation, medical translation, it could be general translation, it could be business translation, so different things. But not here to be like, have like a good base or, for example, or a good background in healthcare and in medicine. So therefore, a dual training based on that, because of this lack or shortage that we have, and also because of the high cost, then therefore there should be like a dual training is required for each of the following parties. Who are these parties that we need to focus on, especially within our context, to train them first? So we have the medical practitioners or healthcare providers, and I will include also our medical students who go for clinical practice and meet or deal with our patients. They're acting as professional medical interpreters. What do they have exactly? They are competent in medical and healthcare knowledge and skills from their study, from the academic degree that they earn, and from their professional experience, if they are, of course, medical practitioners or doctor in practice. Some of them master 2 languages or more, which is a bonus. But what do they lack? So this is the training component that is missing, and we need to emphasize here on that, that this component needs to be filled in. We need to bridge the gap. So we have the professional medical interpreter who can act as a professional interpreter in the healthcare context. beside his, for example, or her medical role. So they have lack of translation and interpretation professional skills. They haven't studied here how to interpret or how to translate, accurately. So they need the training in here. On the other side, we have the other party. We have interpreters, for example, if we have interpreters or translator acting as, like, for example, volunteering or acting as a specialized professional medical interpreters, we can't consider them as professional medical interpreters without the following. So their knowledge in translation and interpretation, that is their specialization, so they are competent in that. But they have a shortage, or they have a missing component for training, which is the lack of medical and healthcare background and knowledge. They're unaware of that. Even if they have knowledge, it's very little, okay, and needs to be enhanced. And they are also not aware of the medical systems, for example, or healthcare systems of the medical context. So they need also here some training on that to be included. As a conclusion, overall, I'm glad and satisfied to see the consistency of my research findings. And when I attended the conference, I found out that there are a number of researchers who pointed to the same issue that they have in their own country context, healthcare context. But of course, what differs is the languages. The languages, spoken languages, of course, are different, and also the cultural aspect or the healthcare system. Although there are like some similarities, but it is here good to have it. It's not like a local, let's say, it's not a local problem, but it is an international problem that deserves the international research collaboration later on, because the benefits out of that will go to everybody. That gives this proposed project more weight and categorize it under internationalization, higher education, and healthcare or health context matters or needs. Of course, if we have needs and we have something that we want, something missing and something that we need to, we want to do to fill in the missing part or to bridge the gap, for example. So, and here I'm talking about the initiative that have been done until now, up to date, just to meet these needs of having the language communication barrier. And there are lots of them. So to start with the first initiative, a medical interpretation workshop. And this workshop was before conducted in like face-to-face in RCSI for a few years ago, before the COVID. And in here we were like also inviting a number of healthcare providers, especially nurses, to the from different hospitals to RCSI Bahrain to come for this workshop and attend it. It's like a one-day workshop actually, and that's the here are some points about the workshop. It is something here to train these practitioners for the OSCE exam or for the clinical examination, to help as mediators or as medical interpreters, to help these students who are non-Arabic speaking medical students, of course, when they here, for example, do their exam and communicate with Arab patients. In RCSI clinical exam, medical students are examined in their ability to take a patient history. So taking a patient history has verbal communication is required within this process. Conduct the physical examination by giving instructions and explanation to the patient. You need also the verbal or a non-verbal, of course, communication will be required. Discuss aspects of their patient diagnosis and medical care to the patient or to the patient next of kin. That also will require verbal and non-verbal communication. In this long case exam, there will be these parties a patient. So we have, I mean, like these attendees or these healthcare provider, they act out, and I mean, like they have different roles, and they can switch to have, like, for example, to act as a patient, and one type, for example, a medical student. It could be the two senior medical examiner, or they can also act as invigilator. Here is the setting how medical interpreters, these, for example, volunteers who will volunteer as medical interpreters or mediators, how are they situated? Where is their position exactly? So we have here, it's like just a chart to show us here the, for example, where are they situated? Here we have the healthcare provider. In our context or institution, we consider this person as the medical students. Let's say the non-Arabic medical student. The medical students will be placed in here. Okay, and here we have the patient. So between the patient and the healthcare provider, there will be the mediator, the interpreter, either this side or the other side. Like in our local or in our institutional setting, examination setting, we have here the patient, the mediator will be the side, the medical students will be in here. On the right side will be two examiners, the first and the second senior examiner. And between a partition, there will be a partition in here, and like behind the partition will be an invigilator. The time allocated within the training, which reflects the same actual time taken for the examination. So they have 46.5 minutes. These are divided as the following: 19 minutes, student takes an observed history, and this is what will happen within the training, also in the interpretation. Students in 5 minutes presents or discuss the history, the patient history, of course. The student, as well as by taking the 12.5 minutes, will examine relevant systems, and the last 10 minutes will be allocated to discuss exam findings or management. So, of course, we know that RCSI examination must be conducted through English language, and this is understandable. This applies even when the patient, student, and examiner all speak the same language, so there is no language barrier. But in case of having language barrier, for example, in here we need the mediator. So we have the workshop done in 3 languages beside English. We have Arabic, we have Hindi, and Urdu. So we took that because of the majority of the spoken language among our patients in different hospitals in Bahrain context. A mediator should be there to ensure an authentic interpretation of the students or patient interaction. And also here, the mediator role in the team plays a crucial role in the exam process, particularly in the history taking section, or while the student is examining the patient, giving instruction, explaining certain things, medical case, for example, the medical case or the healthcare health issue, for example, the patient has, right? And here they need the verbal communication, of course. Mediators who volunteer to help in medical interpretations are advised to not correct what they perceive to be incorrect information. So they have to act as like first person, not a third person, okay? And they have to transfer the language as it was said, exactly, 100%, okay? Not to correct if there is like incorrect information. That's here the let's say here the transparency or the I mean like the interpretation role. To be honest also in their job, and transfer or translate things like from the target language, from the source language to the target language, 100%, especially in interpretation. So in here you can see like they're also in conferences or for example, let's say medical conferences or whatever, in any setting that needs like interpretation. We have interpreter speaks for the person or the patient, both sides of course, and they interpret, switch from English to Arabic, Arabic to English, and in different contexts will be different languages. Professional interpreters take notes while listening. So this is also advisable while listening, like taking notes for 2 minutes only. They should be quick, they should be accurate in that. Then, of course, represent the speaker. Ability to master many topics in detail is required from the interpreter. They should be skillful and well trained. So here, translator conducted during the exam. Just here, what do they do? That is related to the workshop itself. So patients who require translation or interpretation and students will be asked to speak in short sentences only, that you as, for example, volunteer to interpret will then translate directly as a first person. So the students will be briefed to speak directly to the patient, not through you as a mediator. As well as within the workshop, we were also, we were also like sharing some videos, short videos, of course, to show the participants or these volunteers, medical practitioners, what is the correct interpretation, medical interpretation, and what is the incorrect way of medical interpretation, the do's and the don'ts, so they understand how it should here go, for example, in a good, successful or perfect interpretation before they do the role play. Then they have role play, and we have these 3 groups, like English, Arabic, and English Urdu, or English to Hindi, and vice versa. Okay, and each one was led by someone. I was leading the Arabic group, Arabic English. And there were other cohorts from other hospitals who are also, and from the institution, from RCSI as well, and from the SARA office, they were also helping in Hindi and in Urdu. So we are aiming, I'm trying here to improve this workshop and make it more blended to benefit many people or many practitioners or healthcare provider from it. It could be virtual, or it could be face-to-face, or could be both blended. So we'll take this approach, and we'll also like adding more components to make it more interactive and also rich in training. And the time will be expanded also. One day is not enough. Few hours will not be enough. There should be like a good training, and this is what we aim to have. And as we said, certified training programs. The second initiative, it's a collaborative action research. This collaborative action research is part of the LCU research pillar, collaborative research with other institutions. I'm collaborating with the university, the British University in Dubai, BUID, and we have here a study entitled Investigating the Role of the Arab or Bahraini Patient Care Assistant, the BCAs, that we have in some hospital, in assisting in doctor-patient communication and medical interpretation, and finding also ways to empower them to become professional medical interpreters. So we are doing this, currently we are working on that, and hopefully we'll share the findings later on when we have this project finalized. Of course, this is an action research which aim for future implementation and future projects that we can implement and design for RCSI and for the local hospitals that we have. So Some common major keywords representing the role of BCAs. The third initiative is an online blended professional training. These are the short courses done especially for the medical students more. So I tried here to do that blended approach, of course, to be followed to train these non-Arabic speaking students by having a language supportive program. We had before the COVID, we had the both the face-to-face and as well as we also integrated a software, a Rosetta Stone Arabic language learning software, plus the clinical Arabic, which I conducted face-to-face. Nowadays, after the COVID, there were some students in different medical cycles who seek my help, and I was organizing also to them some workshops and some short courses in their free time, just to help them with the language barrier until we have the formal courses, training courses or support, and now we are planning that within the TIP2, and hopefully we will have a full package of language communication support for healthcare and for clinical and medical purposes, of course. And that will support medical practitioners who are non-Arabic speaking, medical practitioners, for example, medical students or nursing students who are non-Arabic speaking in the first place, to support our institution students, and also the healthcare providers who will seek, in different areas, who will seek help here from other hospitals. RCSI can be the main, of course, here provider for these training in the future to the local, could be. We aim first for local medical providers or practitioners, and then we can move for more international stage. The fourth initiative, establishing a professional license. And I took the opportunity from the stage of the conference to call for urgent need to train medical practitioner professionally to become certified medical interpreters or translator. So that is here a call for establishing a professional medical interpreter or translator license. And this is, of course, can be applicable to different, if we aim for later on internationally, we can include different languages as well. But the same component, teaching components or training components will be involved. The things that could differ, the language and the cultural aspects could be according to the context. But we can focus now on the Bahraini context first. What I recognize to be important and require experts in the field attention is that healthcare providers, of course, and practitioners, they have their, let's say, academic degrees. So what do they need? For example, as something extra, we need here something more important, which is the professional qualification. We have academic qualification, we need the professional qualification that will help us to expand, for example, our offers in the medical and healthcare setting. Like, for example, acting as a practitioner, medical practitioner, acting also in a dual role or a second role, for example, professional role as a medical interpreter as well. So for that, they need the professional qualification, and this is what we would like to design based on, of course, based on research findings, and that will be evidence-based. Training opportunities in academia in the area of medical and healthcare interpretation. We can have workshops, we can have in-service or on-the-job training, professional certificate programs. There are lots of varieties that we can think about. Available, relevant, approved or accredited courses and programs that are offered currently by, there is like some, like some courses like in other languages, of course, run in other languages, not in Arabic, by American Translator Association. And some of them are face-to-face or some of them are hybrid. Of course, we aim to have these like options to have an equity, and we give like lots of varieties of options to our, let's say, our learners or target learners. So they can select or choose or benefit from different learning approaches. I think that suits them. Face-to-face or residency program, we can also, RCSI can host that. These programs, even like from some participants or candidates from outside who would like to apply later on. Bridging the Gap programs, part of a cross-cultural healthcare program, a major part in an induction and orientation program. This is what I want also to to highlight. This is based on my findings that there should be an within the induction program or orientation program, whether it is for our students or for the medical practitioners in Bahraini local hospitals. We need to have this training component, even if it is like a starting or short component, to teach these newly hired or a newly, for example, joined, let's say, students or practitioners in hospitals, to teach them the Arabic language communication, starting from the general, going to the specific purposes like medical and healthcare purposes, language communication. It is very important, and based on research, preferably that the theory or the knowledge should be integrated with the practice. And this is what we refer to from the first slides, that the terms, for example, medical terms like in Arabic or in English, shouldn't be here taught separately. We should put them into real context. The learners, they should be trained here to use them in real-based doctor-patient scenarios, to make use of whatever they learn of medical terms or terminology, and use them also in the real scenarios, in their own practice or clinical practice, and then get their feedback, how it was, for example, by applying what they have studied in these training courses in their practice. And then find out, for example, if any ways of improvement or if any missing part that we missed, for example, from the students' feedback. So the evaluation is very important for such training or new training programs. I was also proposing and trying like to share that with colleagues within the conference in terms of collaborating. I'm also here trying to propose certain components or important components to be included in these training courses or programs. So proposed courses or certificates, training programs in medical and healthcare interpreting or translation may need to have similar or different of the following components: the type of content, the duration, number of hours for theoretical and practical parts, credits. We have also, if they are accredited, for example, or certified courses or training programs, there should be also certain credits that the candidates will have at the end. Location of the training and the medium of delivery, how it will be delivered. And as we said here, we try like to have a type of a blended approach, so it can suit many types of candidates, of course. Here, those people who have no time like to come in here or to come to campus, for example, or to have face-to-face, they can have the virtual or they can have both. Core competencies for translation and interpretation, language combination. As well as I was also proposing main components to be included in the medical and healthcare interpreting course or certified program. Like, for example, language accuracy, mastering at least these candidates should master 2 languages or more, depending on the context. Like in our context, we have the most important languages for interpretation. We have Arabic and English, as well as we also pointed to Urdu and Hindi as other also common languages that we have in here in our population. Application of the main fundamental roles of the interpreters, ethics, like healthcare ethics, management of the flow of communication as a component, cultural competence depending on the context. In my context will be the Eastern Arabic culture. And we have also practical interpreting practice, rotation in different hospital departments in the relevant work context. As we said here, integrating the theory and practice. These training courses will not have only theoretical part, will have also application and practical part where these trained, interpreters to be in the future, they should also go in hospital as a rotation and apply that and use it. And there should be here a supervisor who will evaluate their performance as part of their program. So one additional important teaching component will be understanding the healthcare context, healthcare system, for example, the language and the culture. As well as number 7, we have modes of interpreting as a component, memory, practice and development, quick. These interpreters, they should have these values or competency, being quick, being accurate and note-taking. Science translation practice and basic medical terminology, professional conduct, self-care and professional growth. These courses can be both with a standardized level and can have other programs designed for different medical and interpretation, for example, for specific purposes levels. It could have different levels or could have one level from novice to experts, for example, or to advanced level proficiency. These are the references used. And also I allowed any questions. If you have any questions, colleagues, you can also, I'm sharing my my work email address, and as well as I am placed in RCSI Language and Culture Unit, LCU Office 305 Level 3, but you can also use my email if any queries or if you would like to collaborate in the future project to build up the license. And thank you for your good listening. Thanks so much.